All righty, we are gathered here today. Thank you for joining us. If you are joining virtually, we are here to demand and urge treatment, prevention, and protection for people behind bars. One of the things that we know about jails and prisons is that historically they are deplorable conditions inside of them. I know as a provider who goes in with New Hour for women and children, I see the chipping paint and the dirty floors and the unsanitary environment that many of our corrections officers, administrative staff, and people behind bars live with. And what we know is that this long history of deplorable conditions leads to death. And what we know about the current COVID-19 pandemic is that there will be death as a result of lack of medical care if we do not do something now. We are here gathered with advocates from across Long Island to join the New York State effort to ask law enforcement, corrections officers, our county executive to tell us what's happening. Is PPE being provided? What is happening to provide care and safety for those inside the jails, those who work in the jails, and to let family members know what's happening? What we know is that people are being locked in cells across New York State instead of being given proper treatment. People are scared, they're afraid. We've had deaths all around, and we're going to see this continue if we don't do something now. There are nurses who are putting their lives on the line. There are doctors putting their lives on the line, and nobody is remembering to care about those who have been completely forgotten. Those are the women behind bars, the mothers. There are babies in Bedford Hills. There are people behind bars who are not being cared for, and nobody cares about them. And one of the things that we realize is that what happens in prison and jail comes out to the community. Jail health, this jail health is community health. People who are serving time in the jail will come home. They're serving under a year sentence. They are there for misdemeanors oftentimes. They are here and they are afraid of dying behind bars. We are gathered here as directly impacted faith leaders and advocates to urge testing, treatment, and release in many cases where it makes sense to keep our communities safer and to ensure that we stop the spread of COVID-19. I would like to introduce our first speaker, Susan Gotterer.
Hi, good afternoon, everybody. No, I'm okay. My name is Susan Gotterer, and I'm the director of the Nassau County New York Civil Liberties Union. We're here today for several reasons. To let the people inside the jail know that we care about you and we're fighting for you. To ask that the county leadership provide a written plan to the public outlining how they will protect human lives inside this jail. And to ask the district attorney, the sheriff, and the county executive to work together to identify those at risk. And that means people over 50, people with threatening medical conditions, mental illnesses, people who are pregnant and who are close to the end of their sentences. I'm very sure that whatever they are in here for does not call for a death sentence, which is what they are facing. You know, if you're going to run it for office or take a leadership role in governing, you have to have a real plan, ready to go in anticipation of a crisis. And as far as we can tell, forms have not been sanitized. We have told people inside that regular temperature checks and masks and gloves are not available. We are being told that they are not allowed to ask for a doctor's visit. I'm going to repeat that. They have not been allowed to ask for a doctor's visit. And we know that the solution to social distancing is not keep locked. They've been in their cells for 22 hours a day. The county, shall I repeat any of that? Yeah, okay. The county executive has not given statistics on incarcerated people, since April 17th. That last count was at 23. She routinely provides the numbers of corrections officers. That count was at 44. That leaves us to believe that there's a difference in how she values lives. We challenge the county executive to explicitly state that the lives of those in the Nassau County Jail matters and that she has a plan. We have received phone calls from many families who describe their family members as having pulmonary disease and asthma. Finally, we know that everyone is working hard. We do not question that. But as advocates, our job is not to pay attention to your intentions. Our job is to pay attention to your impact. Keeping people in cells for 22 hours is unconstitutional. People with mental illnesses being kept in cells is completely inhumane. We have been calling on the county executive and sending emails for weeks with no response. That is not encouraging. We would welcome a conversation, but in the meantime, we would like evidence that the county has a written plan to save lives inside this jail and a plan for releasing vulnerable people. Thank you.
Yeah. Thank you. Can we get a wipe? Please, thank you.
So thank you, Serena. Thank you, Susan. Our next speaker will be Pam Neely. She's representing New Hour for Women and Children on Long Island, as well as the Nassau County Jail Advocates.
Hello, my name is Pamela Neely, and I'm here speaking as a formerly incarcerated individual of this same jail. This is ridiculous. People have sentenced to death. We're asking our elected officials, we need your help. We can't do this alone. We need your help. We need to free some of these people out of here. Don't let them get sick and die. This is not right. And it's not just the inmates, it's the officers. It's the medical staff. It's everybody that's inside this jail is putting their lives at risk every day. As we stand here, I see the officers and staff going in. They don't know what's going to happen to them. Please help us. We need help, and we're asking you to do this now. Don't let this jail be a death sentence for people. Thank you.
Peggy. Thank you, Pam. Our next speaker is going to be Peggy Perkins, representing New York Communities for Change.
My son? My son? My name is Peggy Perkins, and I'm from New York Communities for Change. I am here to demand that everybody in the jail receive proper treatment. It is horrific that these inmates have been treated inhumane treatment throughout this pandemic and before. Their families and friends have been concerned, have been suffering because they cannot see their loved ones. They cannot stand things that they need. It is not right that Cuomo is stating that everyone deserves to be treated with fairness when we have these inmates sitting in jail, suffering. It is pathetic how they jail. It does not mean that they do not deserve to. Oh, they stopped.
Awesome. We lost our feed. That's all right. We'll just move. We'll reconnect and we'll just move to. Thank you, Peggy.
Thank you.
All right. We're going to connect to Anthony next, I think, right? Anthony? Okay. All right, Anthony, if you want to hold the phone, I'll just wipe it down. And you're just speaking to here. And that's it. All right, we're back. Thank you for bearing with us. We're going to resume our call for proper treatment and care for those behind bars. I'd like to introduce Anthony Dixon with the Parole Preparation Project, who is here to share more about this important issue for us.
Thank you for those that are joining us today on this Zoom gathering and rally. We're in Nassau County, as you know, a jail that has been around for over half of a century. And we're here to protest about the inhumane treatment of those that are inside concerning their conditions. They are not allowed to have face masks. They are not allowed to have hand sanitizers. And in a dorm setting, they are unable to adhere to the law of the land about physical distances. It's impossible for it to happen. So they are in harm's way. And we're here too because this particular jail is in a county that is considered the hot spot of New York State. And not only is it the hot spot, Nassau County has the highest infection rate in Long Island. And there's over 21 reported cases of individuals that have already contracted or tested positive for this death sentence. And although Nassau County executives have moved to do what they think is correct, we believe that is appalling that they have not done more. We think they should consider those that are most vulnerable, who are 50 years and older, pregnant people. We think they should also consider those that have compromised immune system, particularly those that are on dialysis, that have respiratory problems. If this virus hits them, it is a death sentence. That's who it's coming from. Not for the low-hanging fruit, people with misdemeanors, or those that you can let go that are not in harm's danger. Of course, we also want to hold up the fact that you have put them in harm's way. No mention is made that officers are being told that they have to wear masks when they go inside of these facilities. We have no indication on the DOC website or the Nassau County Sheriff website that they are adhering to wearing masks, that they are testing these officers before they're going in. These are the principal carriers of this disease. So we believe that they should also become more transparent concerning how many people in Nassau County Jail are in fact infected daily. It should be on the website. If DOC has done that on a state level, we believe also that the local jails, particularly here in Nassau County Jail, should do the same and follow suit. Be transparent with the community and do what is right. We're calling on those that have administrative offices, judges, the sheriff department, and the governor. This is troubling what is happening here. And it's appalling that more is not being done. We demand transparency. We demand that you deliver people from death's door instead of leaving them in here to be vulnerable setting ducks. Nassau County Jail is a sardine can. It's impossible for them to follow the law of the land, which you have told us to follow out here. And it's appalling that you're not doing the same thing for those that are inside. Thank you.
Thank you, Anthony. Our next speaker is Nathan Stange from Bend the Arc. Thank you, Nathan.
Good afternoon, and Ramadan Mubarak to our Muslim brothers and sisters. I'm a volunteer organizer with Bend the Arc Jewish Action. Since the outbreak of COVID-19, I have been fortunate and privileged to be able to work from home, safely shielded from much of the pandemic's danger. As we stand in front of this jail, my heart breaks for all Long Island families who cannot say the same about their incarcerated loved ones. A couple of weeks ago, the Jewish community celebrated Passover, a holiday where we observe the coming of plagues and the escape of the Jews from slavery under Pharaoh in Egypt, who Moses urged, "Let my people go." Well, our plague has come, and ironically, Governor Andrew Cuomo seems pretty comfortable playing the part of Pharaoh. At a press conference, he touted the production of hand sanitizer by incarcerated New Yorkers via the state Corecraft program, effectively slave labor, paying as little as 16 cents an hour. Pharaoh Cuomo has championed regressive rollbacks to bail reform that will lead to the unnecessary incarceration of thousands more New Yorkers during this current pandemic. Pharaoh Cuomo has failed to use his power to grant clemency to scores of our neighbors who will die in jail from COVID-19. 75% of the people inside this building are being held here pre-trial, guilty of nothing. The other 25% are serving sentences of less than 1 year. None of them deserve to die. The kind of society we want to live in. Will we accept a status quo that over-polices and murders Black children? Or will we provide education and public health? Will we accept the system of mass incarceration that tears communities apart, incarcerating Black people at a rate 5 times higher than whites? Or will we heal our communities? Our leaders have a choice to make, and I hope the decision weighs on their conscience and their soul. I hope our Christian leaders heed the words of Jesus in the Gospel of Matthew. Whatever you did for one of the least of these brothers and sisters of mine, you did for me. Our incarcerated brothers and sisters are suffering, and they deserve redemption. I call on Governor Cuomo to let our people go. County Executive Laura Curran, please use your voice today. Demand Governor Cuomo grant mass clemency to the elderly, high risk, and pregnant women. Thank you.
Thank you, Nathan, for those words. Again, my name is Lucas Sanchez. I'm with New York Communities for Change. We have a message, again, to the Nassau County Executive and the Nassau County Sheriff. Let our people go. Let them 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 go. Thank you. We need testing. We need treatment. We need release. We need testing. We need treatment. We need release. Nassau County Executive, Nassau County Sheriff, you must take action now. You must take action now to protect the most vulnerable people in our communities. Our brothers and sisters in this facility are the most vulnerable people. They are the ones that need your protection. You must take action. Again, give them the protective equipment that they need. Give them the testing that they need. Give them the treatment that they need. And above all else, let them go. Please let them go. Do it for them and do it for our surrounding communities. Thank you.
Yeah.
So with this, we conclude our press conference. Thank you.
Testing and treatment. Testing and treatment. Testing and treatment.
Testing and treatment. Testing and treatment.
Testing and treatment. Testing and treatment.
Let them go. Let them go. Let them go. Let them go.
Let them go. Let them go. Let them go. Let them go.
Great job, everyone.
Thank you.
He said that everyone has to stop beeping so we could do the interview.
Okay.
And me and her are gonna do the interview.
Okay, go.
Okay, great. Lucas, what's your Twitter handle? I'm gonna shut this down. Hey, bye everyone. Thanks so much for joining us today. This is Dave from the Rap Campaign. We really appreciate everybody joining us. We're wrapping up right now. Folks are gonna continue some horn honking over here, but we really appreciate you all joining us. And we're not gonna stop fighting until we get our demands met. We need testing, we need treatment, we need protective gear, and above all else, we need people to be released. Thanks so much, everyone.